Joining us for more is Dr. Vin Gupta. He is a global health policy expert, pulmonologist, and MSNBC medical contributor. Dr. Gupta, you are a real doctor, as I like to say. You know, you got some TV doctors and you got the real doctors out there. What is your reaction to this? What do parents need to know?
You know, Simone, basically this decision is stripping parents of any ability to make any decisions for their kids on this specific vaccine regimen for young infants. So if a parent is a parent to an infant between, say, 12 and 15 months of age, that's really the age group in question. This combination shot that's gotten all this attention, MMRV, no longer will be an option, we think, if the CDC director signs off on this. And, you know, my wife's a pediatrician. I know the American Academy of Pediatrics leadership quite well, Dr. Cressley and others. No one thinks that there was a problem because they already had this all figured out. Nothing new, no new data has been unearthed since Kennedy has come into office and his team. This is just a lot of noise and distraction from real problems they should be tackling. You know, really, people went for the MMRV vaccine for young infants, if for a few reasons. One of which was lumping shots together if their child was needle phobic, which child is not needle phobic, and if they didn't have, say, an increased risk of, say, seizures from a family history perspective. So this was a thoughtful, considered decision between a pediatrician and a parent before this combination shot was utilized for young kids, for young infants. Now it's not an option. And by the way, the CDC and the AAP already recommended the split shot approach for these two pathogens, and measles, mumps, rubella, and varicella, to split it anyway. So this is a bunch of noise to distract from the real work that they should be doing.
So why would they then do this today? Is it to add to the vaccine hesitancy, like the questions that people already have that are already out there, because that is on the rise?
Well, you know, it looks like their hallmark here is faux transparency. They're going to accuse prior administrations of hiding data from the American public, doctors of hiding data from the American public, and claim that they're these white knights riding to the rescue of the American public, doing something that we didn't already know was a thoughtful, considered approach. And science and medicine, it's the art of medicine. There's nuance here. You have to have these discussions. What they're basically doing is depriving and really entering into the doctor-parent-patient relationship and telling them in a patriarchal way, this is what must be done without any need. And again, this is not a crisis. What I worry about, Simone, is what they do tomorrow. This is just the canary in the coal mine. Tomorrow's a big day. Hepatitis B vaccine, they are signaling that they're going to end the so-called birth dose. What is that? That's basically giving hepatitis B vaccine to a baby once they're born, the first 24 hours of life. And there's a reason why we pursue that policy, because we did something different that we think that they're going to recommend now, which is move it to a screen and vaccinate approach, which missed a ton of babies that got exposed unwittingly and didn't get screened for the disease. And so if you assume people get screened, and there's a lot of barriers to access in healthcare, they're kicking a bunch of people off Medicaid, by the way. Sometimes people won't get screened because the Trump administration is making it a lot harder to get basic tests. So who's to say that they're going to be able to come back and get this vaccine? They're making it a lot harder to prevent something that, by the way, Simone, a baby, if they're exposed to Hep B, in the first weeks of life, 90% chance they develop chronic liver disease from this virus. So they're just creating yet another problem that didn't have to be a problem.
These things are preventable. Dr. Gupta, then who should people be trusting? Do you trust the information from this committee? And if not, what should folks at home watching do? Who should they ask? Who do they call?
Well, the best answer is always talk to a medical provider, but let's just be real. Medical providers have a lot to deal with, and yet now the Trump administration is making it hard for every medical provider in the country to do their job. Let's be very clear there, including pediatricians. I recommend everybody go to healthychildren.org for evidence-based, calm, apolitical medical information on childhood vaccines. The West Coast Health Alliance, which is a group of states here on the West Coast, is basically following the guidance on healthychildren.org. Also from the American Academy of Pediatrics, they published the healthychildren.org. It's all consistent. So states now are saying, you know what, we're going to ignore what ACIP is doing, what Kennedy is doing at the federal level. We're going to go our own way. Insurance companies are going their own way, embracing what healthychildren.org and the states are doing here on the West Coast and parts of the East Coast. So healthychildren.org is a great resource for the parents out there. For adults confused, and I don't blame you, this is all confusing. The Trump administration and the Kennedy HHS, all they're doing is flooding the zone with confusion. They're not helping anybody. Go to immunize.org for information that's clear and follow your state guidance, especially in a state that's following what these medical societies are doing.
I wrote down the website. Dr. Vin Gupta, thank you so much for cutting through the noise for us. When we come back,